Well, I'll hand it to you. All right, so this is how you set up a chest tube. We're going to hook it up to this tube here going into this gentleman's chest. So this is the atrium. Comes in a box like this. Take it out, throw the box away. First thing you do is turn this. That's how it sits. This is how you know if somebody knows how to set this thing up or not. If they leave it like this, they have no idea what they're doing. Doing like this, you already know they know what they're doing. This is the collection chamber. This is the water seal chamber. There's a little blue bead down here in the bottom. With this on the back, there's a water bottle. There's usually a diagram that tells you how to work all this stuff. But the sum up is right here where you hook the suction up 90% of the time, all you have to do is take this, squirt it in here. What will happen is the water goes into the water chamber, the water seal chamber, and the blue rinses off of that little bead. If somebody, and that's it, that's all you do. Pull this out, hook this part to the tube. If you ever need to change out one, you disconnect it here, it can change it out. Suction goes up to here. My guess is this gentleman's going to have a big air leak. So you take this, plug it in right here, and that's it. And if you come back over here, give him a few big breaths, please, sir. So this, you'll see air. Once he starts giving him breath, there. That's what an air leak looks like. So he got a huge air leak, which we expected. That'll seal over time. This is your dial. 20 millimeters is pretty much all you need. You can dial it up if you need to, or dial it down a little bit, but it comes set at 20. You can go up to 30. You shouldn't really be at 40. But every time he takes a deep breath, that's showing an air leak. That's pretty much the sum up of how a chest tube works. Once you take it upstairs, you put it to suction. In order to put it to suction, you take this, and that's what it looks like when it's got a huge air leak. But what you will see is after time, once we set this down, you'll see stuff start to come into the collection. So the air leak stops because, or it's not as big because we suction out the air from the procedure, and now it's just the air that comes in every time he takes a deep breath from the small hole in his lung. That's it. So this is called a failure of the doctor. So when I was teaching the nurse how to put this in, she just laid it on the bed. I'm not going to tell who it was, and transported the patient. Not a big deal. The only problem is when you set it back up, you see there's blood all in here. So it doesn't work anymore. So the reason this is a failure for me is because I forgot the second most important thing, is that in the handle there are these little hooks. So you pull these hooks up and you hang it on the side of the bed. This has to be up like this at all times, because if you don't, the collection chamber blood runs into the water seal and then it clots off. Now technically it's still working for a little bit until the blood clots off, but we've got to change this out and get a brand new atrium. Isn't that right, young lady?